Welcome to My Nurse Specialty, a podcast for nurses who want a clearer view of what's possible in this profession. Real nurses, real stories, and real possibilities. Hello, I am actually really excited to talk to our nurse that we have here today because she's in medical sales. And in this podcast, our aim is to get you all the specialties that are out there. And I always say you're in a nursing club and you can go into so many different areas. So I'm excited to have Jeannie Nguyen here today. She's going to talk to you about medical sales. Welcome, Jeannie.
Hi, Rebecca. Thank you for having me. I'm so excited.
So I have been following you for a while. I told you that I was following you because I was just so interested in the medical sales field for nurses. Because I remember being on the clinic side at doctors' offices and having medical reps come to show us different things like in medical equipment and then also with pharmacy, et cetera. So tell us exactly what medical sales is.
Well, medical sales is what it is, right? The sales of a product or a service in the healthcare industry. And a lot of people do approach me and they're like, what exactly is medical sales? And it's so vast and it's so broad. But as nurses, we are inclined to being around all of these products and services every single day. And we just really don't have the awareness to know that someone's selling it, someone is marketing that. And it's typically not a clinician, but clinicians should be in this industry. Hence why I love medical sales and I love posting content about it and just sharing this industry and what it's like. So that way clinicians can come over and have this type of job or career too, if that's like something that they want.
Well, I think that if I was someone buying, I would want someone that was in the medical field if it's a medical device that you're
Yeah.
selling. And
Yeah.
yeah, for sure. So we talk about nurses coming into this area and but it's not always just nurses, but nurses are coming into this area.
Yeah, for sure. And I think the thing is, as clinicians or like the broad majority, we think medical sales is like, oh, you're selling a medical device. So, oh, you're selling a pharmaceutical product, like a drug. And that is so much more to the industry because if you think about as a clinician, the products that we use in the supply room, those are like supplies. Those are durable medical equipment. What about the wound vacs that we use? They're not just those type of devices. And so medical sales is just more than those two main broad industries that we think of when we think of like medical device in the OR or like pharmaceutical drugs. And it very much could be like a service-based sales as well. If you think about hospital systems that work with provider offices and they have intricate partnerships together. Like that's considered sales when you kind of collaborate and have those partnerships too. And so when you ask me like what is medical sales, I'm like it could be anything that is of marketing, business development, and partnership, but in like the healthcare space.
So there are opportunities out there for nurses in this area.
Oh my gosh, 100%. And it doesn't even have to be like sales directly. And we could be the nurses that are actually on the unit doing the training and the in services, right? So that could be the implementation, like product specialist versus just doing the managing of the accounts and like prospecting and cold calling and things like that.
And how did you get into this?
Uh, I think that's like a big story I do like to share. Like many years ago, I wanted to advance in my career as a bedside nurse, and I just didn't know where to do that. And I thought the only way was to become a practitioner, right? And I just knew in me with a business background, I have a marketing background, so nursing was my second degree. I just knew there had to be something else where I could find a happy medium. And I started doing some research. And I just like probably majority of the other clinicians, like I knew what pharmaceutical sales was, but I wasn't exactly sure how to get there or if it was something that I could do. And it was in that moment where I was like, okay, I need to do something else. I don't want to be a nurse practitioner. And so it's not like I really searched to be in medical sales. I was at my wits' end to the point where I knew I wanted to do something else, but in healthcare. And I was just applying. Indeed, LinkedIn at the time, just using all these platforms. And that's really how I broke into the industry. But I got into medical sales on the education side. I was a liaison for an infusion pharmacy, and that's really how I started. And I bridged my way into the industry and learned all of these fun, incredible things that medical sales really is. And I've been here for like many years.
So it sounds like you found your passion that you were looking for when you started looking, and then you started kind of getting into this and looking at all the areas that you go into, and you got excited about it, and this is where you've been now.
Yeah, absolutely. I really think it's about what you feel in alignment for yourself and your body and what feels good for you for your career wise, what fits for your life and the lifestyle that we want. As nurses, we know we have many different shifts that we can work, right? And I mean, I've tried them all. PRN, evenings, day shift, post-op. I mean, all these different things. And not until you find a role that really fits with not just income trajectory, but the life I want to live. Like that was important to me. And that's why medical sales, I've been in it for so long. It's been able to give me that happy balance of being in healthcare and having the schedule that works well when I have like a growing family or like my kids are small right now, so I need to be present with them.
Yeah. Now tell us about a day. Like, what's your day look like?
Every day is different. It really is. So currently I am directly in sales. I am a sales representative, like I manage accounts. And so one day I might be traveling maybe 300 miles a day, driving in my car, visiting multiple clinics, and I might be doing lunches in services. But as far as every day, it changes. I wish I had a solid answer because sometimes I'm account planning at home and I'm doing admin stuff, the fun admin stuff that they don't talk about, which is like route planning, expense reports, and pulling data and just making sure everything is in order so that way I can spend the rest of my week like bouncing around from city to city and different types of zip codes and meetings.
So you get to like plan what you want for lunch.
Yeah, well, I usually don't even get to eat lunch. I plan what lunches are going to be fed to my meetings. And so, I get to plan like, oh, you guys, we're going to do in service and you want to eat like Italian food. So I'm going to probably eat Italian with them, or I get to eat in my car after they have lunch.
Yeah.
Yeah.
So, I mean, they definitely are happy to see you. I remember like when the reps used to come, so they're happy to see you. You come over with the lunch or you have it delivered,
Yeah.
and then you talk with them about what your product is.
Yeah. That's That's really just part of it. And medical sales, being a nurse in this industry is truly about leveraging like our skill sets to build up the relationships that we have with our accounts and our counterparts.
Mhm.
And I know feeding our prospects is important because it's how you get time with them. Even as a nurse in the clinic, I was like scheduling the lunches for the doctors. And I'm like, okay, well, you can only come on this day. And so when you flip the script and you become the representative on the outside, it's so, I believe it's really meaningful because I know that their time is precious. They probably don't want to talk to me, and I do want to talk to them. And so I think really even having that respect for going into account and just doing what you got to do and giving them the information that they need if they want to use your product or service to continue that conversation, to build that relationship. And then maybe one day you really have a relationship where you're getting business from that account and then you're helping managing those accounts.
So that's another part of the job is like managing the accounts.
Yeah, for sure. It has to be. I can't just sales is every day I go in, I make an appointment, schedule a lunch, and like that's it. It's not truly a successful clinician in this role is going to be the one that is able to build a relationship and continue managing the accounts and work on them while getting new business too at the same time.
Okay, a nice balance. And people think about sales, they think it's sales, sales, but actually it is relationships. It's relationship building. It's them liking you, you liking them respecting you, like you said. And I love
Yeah.
that you being a nurse in this industry, you've been on the front lines. You know what, you're not just talking about, oh, this is how we do it. You know how they do it because you've done it.
Yeah. And it's so helpful that I don't know how another person actually does it, except for I remember being the nurse that was basically the gatekeeper. Like the reps would have to come to me and I had the calendar and I would book the lunches. And I remembered what I liked, what I didn't like, what people brought, what turned me off. And so I put that into retrospect when I am now the sales rep. I'm like, okay, I'm pretty sure they're not going to want me to come in multiple times a week and bother them if that's not allowed. I'm
Mhm.
pretty sure they're going to want me to get to the point and not just like small talk. Like, I don't have time for that. So I don't do that when I get there either. And also being a clinician, you're right. We know what it's like. So explaining that to them makes you relatable. I'm like, how does your process work? I remember that same process. How did you do XYZ with this product? Or how did that work for you? I remember going through those complications. Do you still have those issues? I feel like our conversations are intimate because I understand what they're going through already. And it's
Right.
very helpful to be in sales and being able to just put yourself into their shoes.
Right. So it's definitely bringing that nursing background and experience and skill into your current role that
Yeah.
builds that relationship.
Yeah. 100%. 100%. And it helps when I'm coming in there. Hi, I'm Jeannie. I'm the nurse with XYZ company. I'm here for this product, or I'm here to talk about this solution. And they're like, oh, okay, well, maybe I can have you come back and speak to our clinic staff. And so
Mhm.
it's really helpful to
Yeah.
bridge that.
Yeah, that's great. So are you finding a lot of nurses in this industry?
A lot of nurses now, not too many, but there are many from previously. I've worked in many different types of sales positions. And of course, I shared earlier, I started on the clinical support side. And it's like most nurses don't go straight into sales, even though that's what they want,
Mhm.
because it's almost like, can I do it? Am I good enough? Is it something that I'm going to like? Because I like educating. I like being around patients. And so I see a lot of nurses coming into the industry on the supportive side first. And then you understand the industry a little bit and you're like, oh, I can probably maybe make a little bit more money if I actually handle my own accounts. And then you'll see some of the clinicians kind of moving over into the direct sales role, which is exactly what I did. So,
Okay. And
yeah.
and is that like what you recommend to nurses that are coming into your industry?
I recommend you have to do what is best for you. If you want sales, I want it. I know I can do it. Then it is okay to go directly from like a bedside position into a sales role. But you have to work a little bit harder on being able to position yourself and translating your skills. You know how to manage account and you know how to do that moving in. And having someone like help guide you through that process is very helpful. So, to answer your question, I don't always see nurses going directly to the supportive side and then moving over. It is probably an easier way to break into the industry, though, because you're not really directly in sales yet. You're still doing implementation or educating on the product and learning those sales skills. And some just stay. They just stay as clinical educators.
Yeah. Well, you got
Yeah.
to find where you I mean, if they're staying there, it's hopefully it's because they live it there at that area and that's where they want
Oh,
to be. Yeah. Or, but
for
hopefully
sure.
it's not because like what you're saying of, oh, I can't do sales and not venturing over to that sales area because they're thinking they can't do it.
Yeah. We can do anything.
Uh,
I mean, we can do anything. We
right.
really can. I freaking love being a nurse because we learn so much and it's transferable to any industry. It really is.
Hmm. So when you're looking for these roles, it doesn't say nurse for sales.
No. Sometimes they have clinical in them. Sometimes they have like coordinators or navigator, but usually the sales reps, they're like sales reps, account managers, territory managers. And so they don't have nurse in them whatsoever. It's not even a requirement. Majority of sales representatives are not clinicians. They have a business background,
Mm.
a bachelor's degree, sometimes an associate's degree with some experience.
So you just have to look for those jobs and then look and see that, no, I can do this because I've worked out on the floors and I know what the product is. So
Yeah.
you're going to find it in actually medical devices like your DME companies.
Mhm. Yeah. I would say the best thing for any clinician that is interested is where are you working now? Go into your supply room. Just walk around and look around. And what do you see? Like you're not even paying attention right now. Go. Who manufactures that IV bag? Who manufactures that pump that you're setting up like multiple drips on?
Mhm.
Who, and that's a really good starting point because that is something that you're familiarized with already and
Mhm.
having that awareness. I'm like, oh, wait a minute. That bag that's dual chamber, flush feed, blah, 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 all these things. It's like you're an expert in it. Who makes it? So start there. That would be very helpful.
Oh, I think that's good advice. Go in there and like
Yeah.
look around, take, note of all the companies that are supplying the supplies at the hospitals and
Yeah.
going and maybe look and doing a search afterwards.
Yeah, like seriously, go into a supply closet and write down five companies that are manufacturing or making any of those products that are using, whether it's a machine, a pump, an imaging. I went to get a mammogram the other day and I'm like, oh, look at this. There's that company, there's that company. I'm looking down at my foot and there's a logo right there. And I'm like, okay, there's four in here
Yeah.
that you could potentially be interested in, whether you're just a clinician, you could look at it. You don't have to be a
Mhm.
nurse.
Right, right.
Yeah, it's
Yeah.
right under your nose.
Right under your nose, didn't even know. So go ahead and look in that closet and start taking note and then
I
go
know.
from there.
Everyone's gonna be in a supply room like,
Scavenger hunt. Tell me
let me look at the Pyxis and let me look at all these medications too. Who manufactures these medications?
right. I mean, everything. I mean, yes, your
Everything.
time, the supply, but everything. Yes. Even big equipment, like you said, the machines
The
and
machines, the catheter, their favorite catheter that you use, like anything. I'm
right,
like, oh my gosh, it's everywhere. And the percentage is the clinician is probably not selling or marketing this product.
right,
They're probably not. It's probably supply chain, someone with supply chain, someone with management experience, someone with a marketing degree or communications degree is doing it. Doesn't mean
right,
that you can't. You're a nurse. You know how to communicate. You know how to market. You know how to influence.
right.
Yeah,
And then you have something that they don't have.
right.
Right.
The leverage.
Right. So, and that's the unique area for nurses to understand and getting into these other industries. Because I've often said that in your careers, you don't have to be a nurse in some of the industries, but if you're a nurse, that you're right, that gives you leverage, and you can use that to get some of these positions that makes sense, actually, right? Doesn't that make sense that it is a nurse that does this job?
It really does. It really does make sense. And I just think about like when I had been a nurse and I remember there was like this rep that came in and they had this maybe it was a Bravo machine. I don't remember what it was. I worked in a GI unit and they were like training me on what the machine looks like. And when a patient leaves with it, let me teach the patient how to track what they're eating and like when to push a button. And I'm like, okay, so you're teaching me in like 10 minutes and you're gone. And then for the rest of my life working here, every patient that gets this procedure with this done, I'm teaching the patient how to use the machine that you just taught me 10 minutes on how to demo. And I'm like, what the heck? And that light bulb came on. I was like, I think I'm in the wrong field.
Right. Yeah, I'm sure that, these companies see how valuable nurses are. And even though it's not advertised to nurses, if a nurse comes in and can definitely sell themselves at that interview on, I've done this work, I know
Yeah.
how to do this. I've worked with, this, I'm a travel nurse and I've worked in this system, this system, this system. I know them and I can definitely, show someone how to do it, would definitely be a plus for that company.
Yeah. Oh my gosh. There's so many travel nurses right now. If you can go into a health system and like learn all of their protocols and everything, and you're just jumping into different units, applaud to you because you can do anything.
Yeah.
Yeah,
That's a skill for sure to be able
that
to
is
do
a
that.
skill. And that is a skill that can come over on sales because you're managing multiple different places. You're going to different facilities and different types of like stakeholders, whether they're providers or facilities. Like you can learn how to just move around the system smoothly and easily. I think that's really helpful too. Like as a nurse in sales at first, people are like, well, how did you get through? I'm like, what do you mean? I just like walked in. I just walk in and I don't look down. I walk in like I belong, and because I
Belong there, right?
feel like I do belong, so I just kind of walk in.
Yeah.
Yeah,
Walk in, but you belong there, and they will definitely know that you belong.
yeah,
Oh, that's so like it sounds like though you do kind of have a little bit of flexibility in doing your own schedule.
yes, I do. I'm currently an account manager, so I do manage my own accounts and my own schedule. And I know you were asking like what my day looks like, and I probably spend about 1 day working at home, like remotely, where I'm planning out my days and doing admin, and then everything else is like wherever my appointments I set up lead me. Whether some days I could be doing a breakfast, I could have like multiple meetings and then cold calls on the same day. But I get to decide that. So
Hmm.
that's one thing I love about it so much is being an individual contributor. I'm like, okay, I know tomorrow I have to pick up my kids early, right? So I'm going to make sure I have an early meeting and then I'm going to probably stop my meeting at a certain time so I can get home in time if I
Hmm.
have to do that. And so that's one thing that I really do enjoy about it in my particular role.
Yeah. Yeah, that's so important because when nurses are looking at their life, what works and where can you add some flexibility in you're still
Yeah.
working and doing everything you need to do, but if there's a spot where you can have some flexibility, that's
Yeah.
so huge to do because in the hospitals, sometimes that's difficult. You have to find someone else to do things, and that's tough. I mean, I also say, there are nurses who absolutely love those 12-hour shifts. They
Yeah.
work that around their life. They'll do weekends only or, Monday, Tuesday, Wednesday and work that out with the hospital. But it's a lot harder to do it that way. But you can. And then this is another side of it of offering flexibility where you have the Monday through Friday schedule, weekends, holidays off. Yes.
Yeah. Yeah, for
Yeah.
sure. In my role, there are some industries like maybe medical device where you do have to probably work on some weekends or have calls if it's necessary. But that's one thing that I look into as well. I'm like, okay, I know what my non-negotiables are. And if I can find a role that fits my non-negotiables, which as a mom with young kids, my non-negotiable is like I don't want to be able to travel like 3 weeks out of a month is like too much for me. And so that is something that is possible, but you just have to make sure you have an alignment with the right role
Yeah.
with the schedules. Yeah, I know some people are like, oh, I want to do it, but I'm afraid to travel. And I'm like, well, you don't know until you actually get the interview. And you
Yeah.
actually need to figure out how to get the interview first. And then you need to figure out how to sell yourself to the process so you can actually get the offer. And then you can figure out if it fits your schedule or not,
Right.
you know?
Yeah. So definitely when you think about the rewards of this position, that has to be one of them, having that flexibility in your schedule.
For sure. 100%. I savor my mornings with my kids and when they're home in the evenings after school activities, like all of those things are so important to me. And I remember working as a nurse when I would come home and I would cry because it was bath time and then bedtime. I had zero time with them. And I was like, okay, yeah, this is only for a few days out of the week, but I don't want this because
Mhm.
the next day I'm sleeping all day and I'm actually not happy. I'm actually very cranky, and I'm not nice. And so I just knew it wasn't good for me because I'm like, I'm not a nice person if I'm not rested. Like no
Yeah.
one wants to be around me and I want to be around my kids, but I'm like not very nice. So I had to make a change because
Right.
everyone was suffering.
Yeah. That's true. I know some people sometimes when I move jobs, people would say, "Oh, is it hard to find a sitter?" I'm like, "No, my kids are fine. It's me. I don't like
Yeah.
missing the time, right?"
They
So,
probably they have no idea, but I'm like, I don't want to do this. I go home tired and give you a bath and put you to bed. Like that's all I get. That's not fair. This is not fair. I'll just cry. Maybe it's like a not a really a problem, but it's not a problem for everybody. But if I don't have to deal with it and I can figure out a different way, oh, you bet I'm changing.
absolutely. And it's stuff that we have to pay attention to, even moms, dads, single people, etc. It just what is important to you in when you're looking for your next role.
Yeah.
hey, if, I'm sure there's sales jobs where you're doing lots of traveling. And
Yeah,
if that's what you
tons.
want to do, then, it's out there, go find it, go do that part. But if there's something no where you don't want to, or you just feel more like you want to be home more, then those
Hmm.
opportunities are there too.
Yeah. Yep.
Yeah.
100%.
So what is the challenges that, what would you say is a challenge of this role?
The biggest challenge is probably going to be having like the stress of like quotas. That's going to be like the hardest is once you transition over, you're like, oh my God, I really am supposed to, what do I do to make sure I'm meeting my goals? Because that's like the scariest part is having that goal in hand. Like in any other job or being a nurse, like, okay, you do your job and then you leave. And it might be there when you come back, or like continuity of care, like it might still be there. But the challenge is like, I really need to make sure I can own this myself. I'm responsible for this. I have to really manage it and you have to do a really good job. But it also, although it's a challenge, it's a good challenge because it teaches you lots of things about business. Like
Mhm.
it teaches you how to manage everything yourself operationally in sales. So I've learned and grown so much from the challenges from being a nurse in sales.
It's like
Like
we
if
say
you
with
don't,
all specialties.
with all
You can learn.
specialties, if you don't do the work, you don't get paid. Like you have to do the work.
Right. Yeah.
Yeah.
But that's what gives you the opportunity to be home and have that flexibility because you are doing the work and
Yeah.
just you're planning it on your own, but you're still doing the work and you're successful at it and people like it. And you can tell you love it, Jeannie. You can tell that, you know. So and that is really what I want for all nurses, right? I want you to
Yeah.
love what you do. And, this might be the position that a nurse would love to be in. And then even within your field, there is opportunities of different kinds of sales and movement.
Yeah. I'm like, don't do something you don't enjoy doing. And I'm so glad that you brought me here to talk about the medical sales industry. But at the end of the day, you got to do what you're okay with doing. You don't have to love it. You don't have to be completely passionate about it, but can it give you the life that you actually want to live? And that's the most important thing
Hmm.
for
Yes,
you and yourself. I just like find something that fits you and it doesn't like drain you. It
right.
doesn't slowly like kill you.
Yeah, nobody wants that.
Nobody
Yeah.
wants that.
Yeah, we start off in nursing and, oh, I'm going to be a nurse, and everybody's so excited about it. But then comes the task and the challenge of finding where you really want to be and
Yeah.
not just be there to finish your shift, get through the shift, survive it, not for that in the hospital and away from the hospital. Yeah.
Yeah. It doesn't have to be hard, but I really believe as nurses, our work is impactful anywhere that we decide to work, and it carries across in any industry that you decide to go in once you become a nurse. It's like I'm service led. Everything I do is service led. And so moving that into sales perspective, a lot of people like nurses are like, well, I can't do sales. I'm like, okay, well, think about it this way. You're providing a service of a product that you're selling, right? Or a medication. And so when you think about it in that aspect and you need to put the word out there to market and talk about it because you truly believe in the product or the medication, that's where you do so good in your work and you're actually helping and benefit. Maybe you're not benefiting a patient directly, but you're benefiting the community. You're benefiting the innovation that's happening in healthcare right now and you're able to spread that word. Like what a gift.
Right.
Yeah.
Right. We talk about nurses too that actually, invent things and make things better.
Yeah.
And those are some of those medical sales that are out there already. Some of them could have been designed by a nurse or, maybe in the future, some of the things that are being the medical equipment, making it easier because you're out there working it and doing it.
Yeah. That is true. That leads me into like, okay, maybe sales, but maybe like entrepreneurs, like, oh, you have that product, or you're actually using it, and you see a shortcut that you can troubleshoot. Okay, go patent it, go sell it. How
Right.
nice would that be?
Well, I know when you're talking to clinicians and you're selling the product, that you're talking about why it's a good product. And
Yeah,
of course, they're going to ask you questions like, well, what about this? And what
yeah,
about that? And hopefully, the product that you have has already solved those problems. And
right.
then it's an easy sale, right? Well, we have this already. It doesn't backflow or whatever it is, right?
Hmm.
And, but, if it does, if there's something and you can make something better, then that's actually something to think about.
It really is. I immediately, I don't know why, I was thinking of like a Y connector, like an IV Y connector. Like who invented that thing? Because, you were saying backflow. When we're at the hospital and we have certain things and you're using them, who invented that? So we can have multiple lines and how to, like somebody did. Maybe it was a clinician. I don't know. But yeah,
Right. But and knowing everything about your product pretty much, is kind of where I was going into as well, that, you know everything about the product and you can answer every question for that clinician as being their representative for that account.
yeah. Knowing the actual product that you're selling or the service, that can be taught too. Like, when you move into sales, those things are going to be taught to you. They're going to train you on that. But one thing that they can train you on, but you have that someone else doesn't have is like that rapport building. It's just so different as a clinician going in to a space where you're selling a medical product or service.
Mhm.
I feel immediately like, oh, I can trust you. Oh, and I don't mean to talk bad about anyone else. I mean, I remember being the nurse in the clinic and this guy came in and he's like, "Oh, let me schedule a lunch and let me like bring you steak and all these things." And I was like, "Okay, great." And I just remember looking at him and I'm like, "I don't know. I don't think you know anything.
Plus
I
you're
don't think I."
busy, right? You're not going to
Yeah, and
be
I'm
there.
like, I thought that. I immediately thought that. I'm like, maybe it was the person was lacking conviction. The person was lacking confidence in themselves, or they just seemed so cookie cutter that I immediately didn't have any trust.
Hmm.
Versus someone else coming in and they just were very confident in what they were saying. And then I'm looking up and I was like, oh, you're a PA and you're marketing that. And then that sparked like the light bulb, right? Like, oh, okay, well, maybe you do know the processes. Let me call you when I have a problem with this product because you could probably help me. So then I
Yeah.
think about it. I'm like, come on, guys, come to sales. I promise you.
Valuable, valuable. I know. So I think we go back to Jeannie as people like thinking, oh, sales. I don't
Yeah,
want to sell. I'm a nurse. But, I hope that we're providing some insight into showing that nurses actually are the best ones to do this.
yeah,
And they also are trusted people that the clinicians are saying, okay, you probably know how this really works because you know what we use and what we need. And
yeah.
then they want to talk to you and give you their account and services. And like I said, can't wait to see you.
I would hope so. Yeah. I mean, I'm advocating. I'm like, come on, nurses. I want to see you all in these sales positions.
Yeah, no, I think nurses would love to, know more about it and go there, but they don't. It's not one of, well, let's be honest, the reason I do this whole podcast is because we don't know what's out there. And,
Yeah.
this is an opportunity that nurses can look into and be very successful and,
Yeah.
thrive. I think you're talking about growing too, and it like you're talking about support, and then you could be sales, and then there's even opportunities for hire as well.
Yeah. There's so much different types of tiers for growth. When I do talk to nurses who want to make the transition over, I'm like, you want to do education? Do you want to do training? Do you want to do sales? You can actually just switch it up if you want. There are healthcare organizations that might hire clinicians for certain roles, and then you can move into different divisions of that system. You could be doing sales training. You could be doing product training to the sales team because you're a product expert,
Mm.
right? You
Right.
could, oh my gosh, you can be work on the back end and help coordination. There's going to be processes where right now as nurses, I know there's tons of remote nurses and maybe they do case management, maybe they do um like care coordination, right? What if you can do that for the products that are on hand? Are marketing products. A patient might have a product. Who's helping that gap when the product lands to the patient's home and like the patient doesn't know what to do and they're not followed up by it? They're hiring clinicians for those processes
Mm-hmm.
too. So I'm like, you could work anywhere. Then you can stay as an individual contributor, which I love being in sales. I love managing my territory, but you could do management, director, move up to a VP. I mean, you could move into the clinical education team and do that instead. I'm just like, there's so many different branches versus I know as a nurse now, there's different specialties that we can work in. But when you think about the specialties as a nurse, and then how do we move up our nurse ladder, that
Mm-hmm.
ladder is very narrow, in my opinion. I'm like, and that really led me to sales too. I would sit back and I would look, where do I want to be in 5 to 10 years? And you look at where you're at the hospital and you're like, do I want to be a nurse manager? Do I want to be charge? Do I want to be a director? No, no, no. So what is next?
Right.
What is next?
I mean, there's not
After,
only one way,
right.
yes, you can do that if you want, but you can go this way, you go
You
this
go this way, you go this way.
I always like to ask for opportunity for growth because if you do get into an area that you like, you know, and seasons of your life change, right? I mean, right
Oh,
now,
yeah.
yes, the kids are little but later you may decide, no, I want to have a territory and move up or direct, I don't know the levels there, but
Yeah.
whatever, the sky's the limit of what you want to do within now what you've been building.
Yeah. If I want to travel more because my kids are older and I'm bored, I could probably move into a different role with a different territory where I'm able to fly more if I wanted to do that. And I think there's
Yeah,
the
that's
beauty of it is like it's a great option and it's there for you.
yeah. Yeah, I love that we're introducing this to nurses, and I know that you're wildly popular on social media with talking about this because nurses
Yeah.
need to know that this is out there. And so, advice for nurses listening, what do you have?
It is possible. It's out there for you, but you have to get it. Like the competition is tough. As clinicians, there are going to be other sales reps, marketers, real estate agents, college graduates that are fighting for those same roles that you want. And so my advice is you have the leverage. So if you want it, you have to work for it. But I promise you it's so worth it. Like I would never leave. I love working in medical sales. I wouldn't have it any other way. And it's taught me so much on not just still working in healthcare, but like how to run a territory, how to build a business, and how to work on my own time. That's how much it's taught me.
Whoever gets this job is going to have to learn. If they're non-clinical and they know business
Yeah,
side, they're going to have to learn the clinical side. And if you're coming in as a clinical side, you're going to learn the business side.
yeah,
So nurses can be here and should be here.
100%. I solely agree with you on that. It's nurses, this option is available to you. Um, it's not considered a down move, it's not considered an up move, it's considered lateral, and then you work your way up. Like you're gonna have to look at it that way too. Because there's nurses that are like, oh, well, I've been in nursing for 25 years. That seniority is out the door. It does not matter when you're making a slight transition over. You've got to make the move and then you work your way up once you understand it, the
Hmm.
industry.
Right, right.
Yeah.
Yeah, but you can do it and you can move up and you can have a whole different area, still use your nursing background, and that's great.
Yeah. I
Yeah.
love it. Stay in healthcare if you want to stay in healthcare, because there are plenty of nurses that I've met along the way and they're like, I'm ready to leave. I'm like, no, you're not. You have to find other options that fit your life and what's
Right,
better for you. Yeah.
right. No, I agree with that. And if medical sales sounds like a good thing, that's something to try and look at. And I just like that you're, talking about that scavenger hunt and looking in the everywhere that you go in the hospital supply room and see what's there. And that's a good place to start looking for job boards and,
Hmm.
seeing under careers what they have for sales and starting there too. And,
Yeah.
they can come find you as well.
They
And
can come find, they're everywhere. Wherever you're working, there's reps everywhere. You need to go introduce yourself,
yeah,
say
network,
hi to people, network.
network.
Yeah. whether it's in person or like through LinkedIn online. That's another thing too. Like clinicians, you guys, where you work now, there's reps every day. Pay attention.
Right.
They're there. Even
Yeah.
if you work in the clinic now, are you picking up your lunch and you're hiding in your desk? That's not going to help you. Like you need to talk to them because they're
Yeah.
willing to talk to you too.
And don't shy away from those trainings, right? When they're saying, oh, there's going to be a training, and you're like, yeah, no, thank you. Right. I mean, we're
Yeah.
busy on the hospital floor, and sometimes we're just like, I don't have time for that training. I'm not going. But,
Oh my gosh.
maybe there's a
Go and get
reason.
their card.
Yeah. Get their
Yeah, go get their contact information.
Yeah, I think that's a good way to do it. We talk all the time on here about the networking and the meeting people, and it really is going to be the way for you to decide where you want to go, what your opportunities are out there, so that you can do
Mhm.
research and look and see, and maybe you can kind of see what they do. I hope that today we gave a little bit of a glimpse of what a day looks like, because I don't know if you guys have shadowing or anything.
We don't, but during hiring processes with a lot of organizations, they will have you like do a field ride to see if you're a good fit. So that's the way that you could shadow, but you'd have to go through the interview process.
Yeah.
Yeah.
Okay. Well, anything else you want to add? I wish I was 10 years younger. I'd be coming over.
Don't say that. I've worked with so many nurses that made the transition. My recent client was like, she's been in the OR for 25 years. Now
Yeah.
she's in sales.
Yeah.
She's like, I mean, it's never too late.
Right.
It's
No,
never,
I love what I'm doing too. So,
I know. I love what I'm doing. I'm like a little bit of everything. Y'all can tell how much I love it. I'm like, you have to love it this much. And if you don't do it. It's not perfect for everybody. And
Mhm,
that's one thing I want to say. I am a nurse. I am in sales. I talk about medical sales all the time, like on social media. It's like what I do, but it's not for everybody. It's
right.
not. But if it has sparked your interest and you can't stop thinking about it, that is like a sign that you need to explore it.
Yes, for sure. For
Yeah,
sure.
come on. We have intuition. Follow it. It
Yes.
usually leads you to the right place.
Right, right. If you're feeling a calling and this, like, something
Hmm.
you never thought of, or you have thought of it, but you've never really figured out how to get in it,
Yeah.
now's your opportunity to go and get that sales card, go and look, find Jeannie on her Instagram. Where can they find you to follow you?
I am on Instagram and TikTok under Nurse Jean Star, and that is where you can find me. But you can probably find me also on LinkedIn.
Okay, that's great. That's good to know. And they can just, follow along, even just to even see, because I know you do a lot of the day in the life in your on your
Hmm.
social media. So even if they're just considering it, or something they think about, maybe that's something in the future, then that's a good thing to do, is just kind of follow along and see what you do.
Yes, absolutely. You know, and I just want to end it with inaction gets you nowhere. So just go do something. You've listened to this podcast. I appreciate the opportunity to be here with you, Rebecca. And it's like the opportunities are endless. And I'm always saying, don't wait. Once you feel something, you feel the pull, you feel the interest, like just go for it.
Right, for sure. Absolutely great advice. Great talking with you and sharing this specialty that you do, because it is a nurse specialty in another specialty, but
Yeah.
nurses are definitely able to go there and succeed and love it like you do.
Thank you for having me.
Thank you for being here. I hope what you heard today gave you real insight into this specialty and helped you see what's possible for your nursing path. Please subscribe so you don't miss what's next. And tell me, what specialty should we feature next? If you're a nurse in a unique specialty that you'd love to share, apply to be a guest on my website. I'm Coach Rebecca. Until next time, keep exploring.